Rather than me coming from Nottingham on my own to talk about what we're doing, I've actually come with Liz, who's our workforce recovery lead, fairly newly appointed, and I've actually come with Emma, who couldn't actually be here, but we're going to have a film, and she's a peer support worker. So I just wanted to kind of model actually just this constantly working together to work out what we want to do. I wasn't quite sure which of the challenges to think about because Nottingham is one of the demonstration sites for IMROC, and we feel as though we're probably confidently on our first few steps in terms of creating a recovery-focused organisation. We have so far to go, which is good because it means I might be in work for quite a long time as I'm recovery lead there. But we really do have a long way to go because everything that you pick up in this area seems to have numerous implications. And peer support workers is one of those things. So if we look at peer support workers, we find that we also have to look at, so we're looking at transforming the workforce, we're looking at redefining involvement, we're looking at recovery education, we're looking at creating a culture, because just by introducing and valuing lived experience in the workforce, the whole organisation has to shift. So I'm just going to take you through quite quickly some of the things we've learned about introducing peer support workers. What we mean by peer workers are people who have taken up this new role in the workforce. And the way they differ from other people, we know that around 35% of our staff have used secondary services, and I think that's about the same in other organisations as well. Devon found the same. The difference between these people and other members of staff is that they are explicitly employed to use their own experience to support other people. And it's by that, through that relationship, through disclosing that, that we think they have their impact. We have, by analysing qualitative interviews with peer support workers and with people who receive that support, identified the core characteristics of peer work and what seems to distinguish them from other workers. And these core characteristics are, strangely, they include mutuality, which refers to the sharing that goes on, sharing of experiences. Reciprocity, because unlike traditional relationships, this is a give and take relationship. It's one in which you can support each other to a certain extent. It's a non-directed, non-prescriptive role. These peers, even though they might be tempted to say, you know what you need to do, this is what worked for me, their training would be around helping people to actively listen and help people find their own solutions. They're absolutely recovery focused in that the peer support workers who we spoke to and people who are supported by them said that these people were constantly believing in their possibility of recovery. That's the hope. They're actually helping people to take back control, and they're also enabling people to access opportunities. They're community facing. One of the things that's been found in repeated research around peer support is just how good they are at supporting people to engage in community facilities, organisations and activities, because they come from that same community as the people who they're supporting. Inclusive, by inclusive, we mean that peer workers are not choosy about who they work with in terms of their diagnosis, the nature of their problems, but they're actually, it's a service which is taking somebody as a person and helping them to achieve their goals, helping them to find ways of managing their particular challenges in order to achieve their goals. They're progressive, and by progressive, I mean that they are working towards those goals. This isn't a friendship, this isn't a static friendship. This is a role which helps people to move forward in their lives. And finally, this is an emotionally and practically safe relationship, and that's quite important. So that's how we would define peer support work, and here we have a photograph of some of our peer workers on the day of their graduation. What I wanted to show you now is how we prepare the peers in the organisation, and this is kind of this kind of nurturing role which we have. It's peer support workers can't simply be recruited and employed. We have to do a lot around making this a safe and effective role. And I think if we do that, we're much more likely to have peers who make a difference to people's lives. So the first thing is that in terms of recruiting people, we find that what we're looking for primarily is that they can demonstrate effective communication skills, that they can demonstrate a level of resilience. People can be effective peer workers even with ongoing challenges, ongoing symptoms of all kinds, but they need to demonstrate ways of managing those conditions. And this is where recovery comes in. We're looking for people who can articulate their own journey of recovery and how they keep themselves well. And we're looking for people who are work ready. That's hard to define, but this is about people who are far enough on in their own journey of recovery to be able to support people who are not so far. And that probably is the difference between people in statutory organisations and that kind of mutual self-help that goes on in many voluntary sector groups, self-help organisations. We also feel that if we are going to employ people in a statutory organisation, then we need to train them. Obviously, naturally occurring peer support, people aren't trained for that, are they? But we feel that in order to employ people within an organisation, we need to guarantee a level of safety, competence and all the rest of it. So we have developed a 12-day accredited course. It's co-produced, it's a course that was co-written between ourselves and Making Waves, a Civil Shoes and Lead group. And the people on that course evaluated incredibly well. In fact, for the vast majority of them, they say it's the most effective treatment they've ever had. It really is a very empowering experience. But what we've learned is that they need a lot of support with any kind of assessed written work. That's terribly anxiety-provoking for many people. And the other thing is, we feel that they do need to have time in a practice placement and to be assessed in that practice placement. Because being able to perform well in the classroom doesn't always mean that people are equally well able to perform in the clinical setting. So we employ around 30 peer support workers now. Very few of those are full-time. We deliberately employ as many as we can, really. The more people there, the more support they can provide for one another. Also, the more able many of them are to sustain that employment, because many of them haven't worked for many years, and so coming into a part-time job is the way to start, and then they can move on to more full-time jobs. Now, actually getting those people into employment has really challenged us. We have had to rethink how we do the DBR. It's no longer CRB, is it? Anyway, that criminal records bureau, we've had to rethink how we work with that, and we now have consumers on the kind of assessment panel. We've had to rethink occupational health assessment and educate occupational health around adjustments at work and what these might look like for emotional well-being. And also we found that the generic stuff induction isn't always enough for people who haven't been in work for a long while. They need to also have a much more particular and steady induction to being employed. How to know what to wear, how to answer phones, how to get through locked doors. It's hard and it's stressful. So we've introduced a separate induction for peer workers. Now, as well as that quite specific work, we've also really had to strengthen the organisation to sustain peers. And it helps to sustain them through this quite distinctive supervision. They do have peer supervision in their practice. They also have management from their team leader, and they also have they also have their own wellness plans. You'll hear more about this from Liz. We work with teams who express an interest in having a peer have now been given a day of dedicated team preparation, which helps them to understand what peer support work is, helps them to identify what role the peers can best have in their particular team, and it ensures that they have a space where they can express their hopes and fears and have those addressed. We now have changed. We have our recovery strategy now means that we're working towards, over the next 3 years, having 2 peers in every single clinical team. And that means that it's not just teams who express an interest in having peers, but every single vacancy that comes up will be reviewed to see whether it would be suitable for peer support worker.